Alright, so let's get into the process of getting this model prepped. Okay, that's going to mean polygroups, but it's also going to mean, remember, polygroups aren't going to behave well. First, we'll just auto group, and I highly recommend you do not use merge similar groups with this model. Doesn't work. Well, it works. I shouldn't say that. Let's do it now, and then we'll just fix the groups, because it actually does work in the hands. But it does weird things like match up a vertebrae. So let's do that first and get all the weirdness out of the way, and then come in and do the rest. So I'm going to make the spine all one. So I'm just Control-Shift clicking on all of these pieces. Okay, and I'm going to deselect all of these non-essential pieces which somehow or another got mixed in there. Okay, obviously these are much harder to isolate, and so in this case what you do is with just these parts visible, you can go in and say auto group. It's not going to mess up anything else. It's just going to assign separate groups. The groups for things that are currently invisible stay exactly the same. So group visible. Pretty simple, right? Get the pelvic bone. Whoa. Okay, and then boom. Get all the ribs, because we're going to want to treat those as separate entities. Get rid of all these extra stuff. Okay, pull out and make sure you're getting rid of everything. Okay, then group visible. Alright, and you can keep the head the way it is, but the teeth are going to be something you want to be cautious of. Do you really want to work with the teeth? That's going to be a debate, right? I'm not going to get into positioning teeth. That's half hours in and of itself, and I don't think that that's time well spent. But I'm going to separate them as their own group. So we'll have the jaw, teeth, the head, spine, ribs. Let's get the scapula as one. Alright. And you might as well just line all this stuff up. Okay. Yeah. I'm trying to debate with the patella. Okay, group visible. Oops, I'm going to undo, hide those pieces, and there we go. And there. So the feet, I've got a lot of different groups I feel pretty comfortable with. So let's turn polyframe off, let's turn solo off, and we're going to turn transparency on, and the very first thing you want to do is get the spine. It's the core of everything. If you don't have the spine right, you don't have anything right after that. Everything is attaching to the center of us. So, got to make sure that's accurate. So I'm going to use move elastic. I'm going to click here and drag down, here and drag up. Because essentially what we're going for now, in terms of the spine, is sort of an upward arc. Okay, we're going for a little bit of that. All right, there's going to be these neural spines, the spinous process for the vertebrae, the thoracic vertebrae, and we're going to keep the same numbers. Okay, there is. Let's just talk about the vertebrae. So remember, there's the lumbar, right? There's the thoracic, and there's a cervical. Okay, in a dog there's 6 to 7 lumbar. We have 5. In the thoracic there's 12. In the cervical there's 7. Okay, so we're going to just keep it the way it is. I'm not going to add a 6th and 7th, or I might actually. It's kind of easy to do that, so we might just do that, just because it's a really cool trick. So large draw size, pull this down, large draw size, pull this up. Okay, and notice, I'm pulling that up as we go 1, 2, 3, 4, 5. As we start to make that transition, from the lumbar to the cervical, thoracic, which is moving down, and then the cervical is going to come up. So why don't we do those two extra vertebrae? I think it could be really neat to illustrate how that works. And then I'm going to do the cervical spine. Okay, I'm just going to get this up. Okay. Let's get our spinous process. So C1, 2, 3, 4, 5, 6, 7. Okay, 1, 2, 3, 4, 5, 6, 7. So that puts, and this was actually probably a mistake, that puts the thoracic, T1, right up there, when actually, to be honest with you, what I would have preferred is that the thoracic be right there. And then the rib cage would be coming down a little bit like this and then flowing up. So that's a bit of a mistake, and that's going to mean that I've got to move stuff around. So let's deal with that first before we get into anything else. It might also be why the spine isn't as far back as I would like, which is good in some ways, not in others. Okay, don't sweat at this point, at least this is my opinion. Don't sweat making these perfect. Because the first thing I want you to do is just get in here and get a sense of how all this is going to operate. Alright, so 3, 2, and 2, and 4. Okay, let's get this spine, so I'm going to drag up and back. Might need to, there we go, up and back, up and back, up and back. Yeah, like that. Cool. To start adjusting the cervical portion of the spine, we're going to have to actually auto-group all of this stuff. And that's fine. That'll work okay for us. But we're definitely going to want to mask things off. So let's just Control-Shift-Click to hide that. And we get a clean selection in there. Alright, so we can mask all that stuff out. And we can just leave that guy. In fact, let's do it this way. Control-Shift-Click and mask that out. Then you can show everything. Control-Click, and you're in better shape. It's a bit of a visibility problem. Let's just Control-Click to invert. That way we don't show everything. So we're just going to slowly pull it up, right? And if you want, try Move Elastic. It's not bad, but it's not the best. And it is going to stretch things out. But I'm not opposed to stretching things out right now, because what's really important is that we get in and get a sense of things. Notice that the cervical spine for the dog is going to be, it's much beefier than ours. So let's come in and use a little inflate solo mode. Okay, I'm going to use inflate where they join. And in a moment, you see this is okay, but it tends to make them really beefy. So you got to be careful, just don't go in and inflate it all together. Try to do it conscientiously. Another option, we can use the move brush, but then turn mask by polygroup on, and then you can move like whole chunks back and forth, 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 like that. Okay, and really what we're talking about here, the problem that you're seeing, is an issue of rotation. So with mask by polygroup still on, we're just going to rotate. In fact, that's not a bad idea to just skew it, but rotate would obviously work best. Okay. All right. Let's see, I'm going to try to grab that spine in there. Three and four. Okay, let's just get a few of the vertebrae around there so I can just match things up a little bit nicer. Done. Already took more of your time than I really wanted to take on that, but that's looking okay. So I'd say we have the spine, but I did mention to you that I would, and I was thinking about coming in and adding to the lumbar spine. So let's turn solo mode back on. This technique I'm going to show you only works when the whole thing is visible. Doesn't work when portions not. And what we do is mask off a section. So you go to move, control, click and drag, right? Then you just drag out an action line. Move is still on. Press control, click and drag. So that's 6. So we'll put 6 lumbar vertebrae in there, about like that. Pretty cool. Let's turn solo mode off, see how we're doing, and I'd say I'm comfortable with that. Now, the rib cage still needs to be positioned, and if you want to make life a little easier, you may go back and get these guys all back into one, so you don't have to go through an enormous amount of pain to get them visible. Oops, looks like the sternum wasn't in the right poly group. Yep. Okay, so merge visible or group visible, and then let's make sure that the ribs and the sternum are the same poly group. Don't want them to be separate. And don't worry about the color similarities. So let's do rib cage, spine, turn solo off, select a different color, or select a different brush, the move elastic, and now we're going to start to adjust the ribs. So this is going to involve pulling them forward, right? Because we're going to get ourselves ready for that sternal notch and what's happening to the sternum and the ribs and the flow. So the back ribs are going to just adjust a little bit, but the front ribs are going to actually pull quite a bit forward. So we're going to fan them forward. And I'm going to do that by probably turning solo mode on so I can have access to these guys. Let's see, is there any... I'm going to mask by polygroup off. No, I gotta leave that on so I don't accidentally get the rib cage. And we're just gonna have to let these kind of be bad for a little bit. Okay. Alright, let's come in and get that situated better. Remember, with this brush, pull down. Make sure symmetry is on. And maybe we need to come into the front view. That's kind of nice, but not well positioned. Okay. I'd say I'm in okay shape. Alright. And let's make sure they're connecting. Now, their ribs are not floating the same way ours are, but I'm going to ignore that in the interest of just getting all of this done. Okay, now I'm pulling these end points back in space, and that last one wasn't working very well. Let's use move topological. B for brush, M for move. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes, I have to count. If I don't count, it does not go well. And we've got a lot of adjustment to do. Because remember, 1, 2, 3, 4, 5, 6, 7. That's our 7th cervical vertebrae. So we've got 3 ribs vying for that guy. That's not going to cut it. We got to move all these down. Okay, yeah, you can see as we've moved it, they've got offset. That's cool. That's what I love this brush for. Alright. Oops. Except for I don't love that part where it forgets. Okay, so we've got that attachment. Okay, and that's going to be good enough. Now let's get them all, make sure that they're lined up. Yeah, I'm comfortable with the way they are. And let's make sure we're getting them all lined up in the front correctly. So in this case, I might use rotate, control, click and drag, and that's going to automatically separate out based on topology. So it's pretty much exactly what I want. Control, click and drag. These are essentially separate beasts. Yeah, about like that. Okay, let's turn polyframe off. We've got the start of our rib cage. It's not the prettiest thing. You can come in here and make it prettier. It's not going to have the exact same curves we have, but it's okay. And if we look at this, let's say move elastic. Let's pull that back in. Sorry, just the move brush. And I would feel comfortable with that. As I change it. Alright. But now we need to come and look at this from a front. Obviously, that's not going to work. Now, this is one of the comparative anatomy elements, right? We're, as humans, our rib cage is orientated completely differently. So it is able to kind of bunch up. It's able to have this extra volume around the spine and kind of billow out in this direction. But a canine is going to have gravity pushing down. So it's not going to do this stuff in the back. It's going to make a much quicker plane change. So it'll be more like shoo, straight down, and then it'll match the volume that we have towards the sternum. So we need to move all of that in. And of course, mask by polygroup, and the best bet really is move elastic. Okay, and don't sweat if they're jumping into the spine or if anything like that's going wrong. Okay, that's all stuff you can clean up, but right now, let's just see how it looks and make sure we've got the width accurately, clearly described, and in a way that, gives us, that we can build on. Cool. And it fits in there. Alright, so I'll be happy with that since it fits. We might need to adjust it a little later once we put the scapula in there, but I don't think so. I think the scapula is going to fit quite nicely on top. So, with that done and said, the next thing to look at is the pelvic bone.